Welcome everybody to Crash 2017, and in this video we're going to talk about chest x-rays, and we're going to really look at 8 chest x-rays that you should know how to read before you hit the floors. And this first video is actually going to talk about a methodological approach to reading chest x-rays. I learned when I was in medical school and internship was something called A, B, C, D, E, and I'm going to use this one here that comes from Life in the Fast Lane. This is a website. There's a lot of great educational material. I believe these guys are out of England or Australia. And they added the word doctors to the front. DRS, so doctors, A, B, C, D, E. And so you can see it's details, it's a ripe image, soft tissues and bones, airways and mediastinum, breathing, circulation, diaphragms, and extras. And so we'll go through each one of these in turn. But first, let's look at the anatomy of a chest x-ray. So a chest x-ray usually comes in one of two types. It's an AP and anteroposterior, meaning they shoot the x-ray from the front through to the back, and a PA and lateral. And this, what we have here, is a PA, and so it's shot from the back to the front. And this is the corresponding lateral x-ray, which is basically a side shot. So let's start first with the PA and identify all the structures on here. First, how about the trachea, the airways? So you can see here the trachea, and it splits into the two bronchi, and this splitting point here is called the carina. Next, I'll trace the pleura, and that's a lining of the lung as it gets up to the chest wall. And then there are also the various fissures that separate the lobes of the lung, like the horizontal fissure here, as well as the oblique fissure, and then there's another oblique fissure here on the left side. And there's also the right and the left hemidiaphragms. The right one is usually a little bit higher than the left one. I remember that because I picture the liver pushing up over here and the heart pushing down on that left side. But you'll just notice that it doesn't really matter that much. And here you'll see the gastric bubble, so that's the stomach and the esophagus. And you can see part of the superior and the inferior vena cava here. And I drew in the heart and its various structures, and so you can see here's the right atrium, and the right ventricle is actually in front, so you can't really see any contour of it, but I guess it's right there. Get the left atrium, the left ventricle here, and the aorta here, and you'll see this little ballooning out thing, and that's called the aortic knob. You can't really see these vessels that well, but I drew them there just to make it look like an aorta. This is actually the pulmonary trunk over here. And of course you got the clavicles, the scapulae, and the posterior ribs here I drew in purple, and then the anterior ribs as they come around in yellow. Now let's go to the lateral view. And so here's our lateral view. We got the trachea here. I'm not going to outline these, but these are the arms sticking out in front of the person, just to try to keep this cleaner. You got your gastric bubble. The right hemidiaphragm here, remember this one goes up higher than the left, and this is your right costophrenic angle. And you got your left hemidiaphragm, remember that one goes a little bit lower, and you got your left costophrenic angle as well. And then we got the heart, right with the right ventricle here, the left ventricle, and the aorta. Sometimes you could see the inferior vena cava here as well. And you have your fissures here too, right? So for the right side, you got your horizontal fissure and your oblique fissure, so right upper, right middle, right lower lobe. And for your left one, you also have the left oblique fissure, so left upper and left lower lobes. I'm not going to label these, but you can obviously see that these are the vertebrae here, the manubrium is here, the chest wall is here. This little space back here, it's called the retrocardiac space. And that's it for the lateral chest x-ray. So in your packet, there's a couple of normal chest x-rays, PA and laterals. Why don't you try to label as much of this stuff as you can in there just to practice. And in the next video, we're going to go through that doctor's ABCDE technique to review a chest x-ray. All right, see you in the next video. Bye-bye.